Hi, I'm Dr. Brian McKay of Core Health in Darien, Connecticut. I'm speaking to you today about one of the questions I get most often is why back pain comes and goes. And it's a very, very good question, but what I want you to understand is much of your pain is positional in nature. So what will happen is your pain is going to be different than you're standing, than when you're sitting, or when you're lying down. And what we have to do is it's important to figure out which one, because quite honestly, the single most important pain is your pain, obviously, but also too is the ones that occur when you sit down, because there is literally 3 times the amount of pressure on your disc when you're sitting down. So if we can get pressure off the discs, you will be having less pain quite often in a matter of moments after treatment. And the way this is accomplished is by using a technique we call spinal decompression. Spinal decompression is a newer, it's been around for probably about 10 years, 12 years now, but we consider that new in the grand scheme of things. And what it does, it takes pressure off of the disc, which is putting pressure on the nerve. So if you have a disc bulge on your MRI, this is a very good treatment, especially if you want to avoid surgery. But let me explain now how these positional things affect you. Most people will feel better when they're standing up when they get into one position, or if they're lying down and get into one position. The body stops, the brain recognizes there's a stasis or homeostasis where you have less conditions affecting it, that the body can start to retract some of the pain. So, some people are more comfortable standing, some people are more comfortable lying down. Generally, sitting down is not going to be a comfortable position for somebody with acute or pretty severe disc bulge in the lumbar spine. So, people who sit will have 3 times more pressure on the discs in the lower back, which are typically affected when you have this condition going on. So what we have to do is we have to identify which position makes you better, and obviously have you in that position for a longer period of time. But we also need to know what makes it worse so we can mitigate some of the pain. And again, the treatment, of course, I recommend for a disc bulge or disc herniation and even canal stenosis, which causes all types of back pain, is the spinal decompression. And it's a wonderful treatment, it's safe, and we're trying to avoid a surgery in all cases. Typically, what I tell patients when they come in, you need to see a 50% improvement within a 4-week period. And as long as we're accomplishing that, then pretty much you don't need to have surgery, and we can work our way out with exercises and a little wrap-up care. But it's an effective treatment that really knocks the back pain right out. And unfortunately, people don't do this treatment sooner on, because the treatment will work faster if someone comes into us sooner. So what I want to go over is the back pain that can come and go is good because we know it can go. And that tells us a lot about how far we can get you in a certain amount of time it will take to correct the problem. So the back pain that comes and go, it's terrible when you're in pain, but it'll make a big difference in getting you out of pain, and we typically do it a lot faster. Once again, I am Dr. Brian McKay from Core Health in Darien. We offer spinal decompression. We've been doing it now for about 12 years. We were actually the 5th people in the nation to take delivery of this treatment. It was originally devised by a Dr. Norman Shealy, world-renowned neurosurgeon, pain specialist as well. So the number below to contact us, please feel free. I look forward to helping you with your back pain. Thank you very much, and have a good day.